My name is Bailey, and I'm going to be your nurse today. How are you doing today?
Good.
All right. Can you do me a favor and state your full name and date of birth?
Craig McAllister, Rouse 0131-1998.
Perfect. Can you tell me where you are today?
At the doctor.
Can you tell me what year it is?
2020.
All right. So based off of you answering my questions, I can tell that you're hearing and that your level of consciousness is intact, and your speech was articulate because I was able to understand it. We're about to start your head-to-toe assessment. If you have any questions during this assessment, you stop me and let me know. If you have any pain or you're uncomfortable, you stop and let me know as well. We good to go?
Okay.
All right, so I'm going to start off by checking your head. I'm going to check your hair, make sure it is full with no balding spots. I'm also going to be assessing your scalp to make sure there's no redness or lesions, and I don't see any, so we're good. I'm going to check your ears for size and symmetry. I'm going to make sure they line up with your eyes, and they do. I'm going to check your temporal pulses, and they are symmetric bilaterally. I'm going to get you to look up a little bit. I'm going to check your eyebrows and your eyelashes just to make sure that they are there and that there's no redness or lesions, and there's not. Checking your eyelids for drooping. I'm also going to pull down on your eyelids and check your conjunctiva and sclera. Your conjunctiva is pink and moist, and your sclera is moist as well. I'm going to do a few different eye tests on you. I'm going to get you to look forward in that corner, and I'm going to shine a light into the side of your eye. Okay. All right. Your pupils accommodate to light. I'll get you to continue looking in that far corner, and I'm going to hold my finger up right here. And whenever I tell you to look at it on 3, please do. 1, 2, 3. All right. Your pupils accommodate to distance as well. I'm going to hold my fingers like this, and I'll get you to follow just my fingers with just your eyes. Perfect. You have equal parallel tracking of your eyes. I'm now going to assess patency of your nose. If you could breathe. Now breathe through that one. Perfect. And I'm looking at your nares, and they are both intact with no lesions or redness. Can you do a big smile for me? And now puff up your cheeks with air. All right. The muscles on your face are symmetric. I'm going to get you to open your mouth. I'm going to check your gum and your teeth, and your gums are intact with no lesions. Your teeth are clean, and there's no foul odors. I'm going to feel your carotid pulse. All right, they're bilaterally symmetric as well. I'm going to feel your trachea, which is midline and slightly movable. Feel for any swollen lymph nodes. You could tilt your head to one side and tilt your head to the other side. Perfect. All right, I'm going to listen for a breathe. If you could hold your breath for me. All right, perfect. So now I'm going to palpate your chest. I'm going to check for any lifts, heaves, or thrills, and if you have any pain or tenderness, you just let me know. Your AP to L ratio is 1 to 2, which is perfect and what it's supposed to be. I don't feel any lifts, heaves, or thrills, and your spine is straight. I've been watching your breathing, and there is no labored breathing, so we can continue on with the assessment. I'm going to listen to your lung sounds. You can just breathe. All right, now I'm going to check your ribs have a slope of 45 degrees, and your costal angle is less than 90. I'm now going to listen to your heart sounds as well. I'm going to start with the aortic, then the pulmonic, then the herbs, tricuspid, and mitral. And I'm going to stay here for 1 full minute. And your heart rate is 72 beats per minute. I'm now going to listen with the bell of my stethoscope, and I'm going to listen for any irregular heart sounds. I'll start again in the aortic, move to the pulmonic, go to the herbs, tricuspid, and mitral, and I didn't hear any. So now I'm going to move to the back, and I'm going to finish listening to your respiratory sounds. Alright, I'm going to listen to the sides. If you could put your arms up, please. Okay. I'm going to do 3 on the left and 4 on the right. Alright, perfect. And I assessed your breathing rate, and you were breathing at 12 breaths per minute. I'm going to take a look at your arms. They have nice pink undertones, evenly distributed hair, no edema. Straighten out your arms. Alright, I'm checking your elasticity and skin turgor. Looking at your nails, they are pink and smooth and rounded with a 160-degree nail bed with a capillary refill of less than 2 seconds. If you could straighten out your arms, I'm going to feel your brachial pulses. Alright, and then do this. I'm going to feel your radial pulses. Perfect. Alright, I'm going to get you to come lay down on the bed over here, and I'm going to lay you down at a 30-degree angle. I'm going to check for your jugular vein distension. And there are 2 plus bilaterally. I'm now going to assess your abdomen for asymmetry and see if there's any visible pulsations. So I don't see any. So now I'm going to auscultate for your bowel sounds. Alright, your bowel sounds are normal. I'm now going to check for any bruise. Alright. I'm now going to lightly palpate your abdomen. If you have any pain or tenderness, just stop me and let me know. Alright, now I'm going to deeply palpate. Okay, now you're good to go. I'm going to move to your legs. Alright, the skin on your legs is intact with no lesions. You have even hair distribution. I'm going to feel your posterior tibial pulse. Perfect, and I'm going to feel your dorsal pedalis pulse. Those are symmetric bilaterally. I'm going to check your nails on your toes. I'm going to check for capillary refill. They are all less than 2 seconds. Your feet are both warm. Alright, and now I'm going to get you to close your eyes, and I'm going to touch the bottom of your foot, and when you feel it, let me know.
Feel it. Feel it.
Alright, now I'm going to check for a Holman sign. I'm going to lift up your leg. I need you to put all your weight in my arm. Alright, I'm going to flex your foot and let me know if you feel any pain in your calf. I'm going to do the same thing over here. Alright, so now I'll get you to sit up on the side of the bed, please. Are you dizzy?
No.
Alright, I'm going to get you to stand up and go stand over there by the stool you were sitting on. Alright, if you could stand with your feet together and arms by your side and close your eyes. Alright, perfect. Could you walk over here and walk back? Alright, and can you walk heel to toe to the end of the carpet? Alright, and turn around and walk on your tiptoes back. Perfect. We're going to do some range of motion exercises. Put your chin to your chest. Head up. Look to the right. Look to the left. Put your hands behind your head. Put your hands behind your back. Do your arms in a circle. Put your elbows like this. Put them out. Bring them back. Bring them out. Bring them back. Alright, can you do your wrists? And then close your hands. Open them. Close them. Open them. Touch your toes. And then lean back. Alright, and now I'm going to get you to lift up one of your legs. And straighten it. And do the same thing with the other one. Alright, and can you wiggle your ankles around? Alright, and then can you do a slight bend in your knees and then stand back up? Alright, perfect. You're good to go and you're done with your head to toe assessment.
Thank you.